Are you really infertile or is your bed game off? Hola! Welcome to Case Stories by Dr. Josie, that's me, where you get to hear and learn stories from the hospital. A young couple that had been married for an year visited a doctor, an obs-gyn doctor. So with obstetrics and gynecology, this is a doctor that deals with reproductive health. So they visited the doc, and their main concern was that they hadn't been able to conceive over the year after they had been married. They had tried all sorts of methods to do so. They had consulted even the church, and they were prayed for, but they were not successful. They had tried all types of libido boosts, all type of fertility boosts, but it was not successful. So the doctor, as first you listen to the history, so you want to know how has the progress been since they were married, and the doc determined that they had tried to conceive for a long time, and it wasn't successful. Okay, I don't want to spill all the story. I want to put you in a little of suspense. Okay, so today's topic, I'm going to talk about infertility. So what is infertility? Infertility is the inability to conceive within 1 year of regular intercourse with a frequency of 2 to 3 times a week. So already the couple had done so for over an year, so they had considered themselves infertile, and now they were seeking medical help. With infertility, there is primary infertility and secondary infertility. Primary is when one is not able to conceive at all, and with secondary is where one is not able to conceive after having a baby. So in this couple, since they hadn't gotten any baby, we are thinking of primary infertility. So with infertility, as a doctor, there are many causes that bring about this. So I'm going to break it down into 3 categories so as to help you understand. So there are hormonal causes, there are physical causes, and then there's behavioral or psychological. So in general, some of these include obesity, low birth weight, use of recreational drugs, alcohol or smoking. And now in infertility in women, as we are going to use the 3 categories. In hormonal causes, it could be an imbalance of the hormones that leads to maybe failure of ovulation or conditions like endometriosis. Under physical causes, we have a defect or an abnormal condition in the reproductive organs. So maybe there is a dysfunction of the fallopian tubes, maybe it has blocked, or a dysfunction in the formation of the uterus. So instead of the uterus being whole and rounded, it kind of splits into 2 and forms a love heart. This means it disrupts the implantation, and regular implantation failure will bring about the infertility. Also, there are the behavioral causes like the recreational drug use, smoking. Smoking is highly associated with infertility. And when we go into male infertility, we are also going to use the same categories. There's hormonal, like in males, there's what we call hyperprolactinemia, where it's an increase in prolactin levels. So an increase in prolactin levels reduces the levels of testosterone in the body, leading to a reduce in sperm count and sperm production. There are many causes of this. I'm just highlighting just a few. In males also, there's the physical causes. So here we are thinking about an abnormal condition or an abnormal formation in the reproductive organs. So maybe it could be a defect in the testes, or a defect in the urethra, or wearing tight underwear that raises the scrotal temperature. When you raise the scrotal temperature, you reduce the sperm production. There's also what we call retrograde ejaculation. So in here, when instead of the semen being ejaculated through the urethra out the penis, it is ejaculated into the bladder. So it's like it's ejaculated backwards. That is a part of the physical. And in psychological or behavioral programs is alcohol, recreational drug use, smoking. So there are many causes that may cause the infertility. And when, as a doctor, when you're dealing with these patients, this is what you're thinking at the back of your mind. Before you send them to do any test or anything, you have to want to know which road they go to, because infertility is not a one-way road. It's not just a one road. So tests include, there's lab tests like semen analysis, where you determine the number of the sperm count, basically, and also the quality of the semen. There's also radiological images where you want to see the reproductive organ to see if there's any defect or dysfunction. So these are the things that a medic is thinking when they're dealing with such things. So the doctor has already consulted with the patients, talked to them, explain to them how these things come about, and infertility in men and women is almost equal. Actually, it's equal. We'd say it's 30 to 40% in women and 30 to 40% in males. So you can't really say one gender is predisposed to infertility as opposed to the other. Unless, I don't know, if you have another opinion, you may share it. And also there are causes, like if a person has had injury during their progress of life in the reproductive organs, that can also predispose them to infertility. That's why I have said any defect in the physical appearance or the physical maintenance of the reproductive organ can affect this. So before the doc sends them to do the tests and everything, you first have to do the physical exam. So he starts with the male and determines that physically he could not determine any abnormality or any cause. So he went to the female and was examining, and guess what? He realized that the hymen was not broken. This is just medical jargon for saying the woman was a virgin. So the doctor is wondering, you've been married for an year and you say you've been trying for an year, so what have you been trying? So this is what, okay, I know you have a lot of questions. I had a lot of questions, but at least for me, I nailed the doctor because I wanted all the details. Like, what do you mean? What were they doing? So to summarize it for you, there was their bed game was off. So like there was no penetration, or rather, I don't know where the penetration was. It was in the, I don't know, unintended place. I don't know. Maybe they don't even have a problem at all. Maybe there's no infertility causing them. So he just sent them home with fertility boosters and booked them for a later date, 2 months later. And when they came back later, they were pregnant. So it wasn't really infertility. It's just that their bed game was off. As a doctor, most of these things are not taught in books. You have to be really keen, listen, evaluate, think on your feet, and think widely. Diagnosing a disease is not a straight road. It's more dynamic, it's more all-rounded. And this couple had been frustrated all along, and they were okay. And I'm sharing this so that when you have a problem, please don't be scared to seek medical help. Don't be scared to ask any questions. Medics are not here to judge. We're here to help. We also didn't know these things. We were taught. So it's not like we're gonna think like we are above you because we know this. We were also taught these things, and we are here to serve you guys. I hope you enjoyed today's story. Till next time, ciao.